everybody. My name is Erica Botner. I'm the program manager for seniors and the SHARP program at CHSSN. I'll be your host for today's session. We also have Alexandra Ethier, who's here to talk with us about the results of her research project that she conducted in the Eastern Townships about access to health and social services for English-speaking older adults. It's going to highlight the resourcefulness of English-speaking older adults and the strategies that they use to help with access. And since the SHARP program is about sharing information, tools, services, and resources for aging in place, today, instead of sharing a specific resource that exists in the community, older adults, English-speaking older adults, you yourselves are the resource. So we're taking it a little bit of a different perspective today, but I think it's going to be really interesting and empowering. I want to thank all of the Quebec English-speaking community organizations and SHARP coordinators and older adults who are here with us today, whose efforts have resulted in this beautiful turnout. Alexandra Ethier attended Bishop's University to study psychology, and during her classes, she gained insights into the challenges faced by the English-speaking community when accessing health and social services. So she decided to do her master's degree in gerontology at the University of Sherbrooke to learn more about access to health and social services for English-speaking older adults. And she's currently a PhD student conducting research in the field of home care and joining us from Sweden, where she's doing a special project. So it's later in the afternoon where Alexandra is, but we're really happy that you're here to share the results of your really exciting research. Not a lot of people are interested in studying this topic. So we were very excited when we found you and found the literature that you had published, and we're really happy to have you here today. So over to you.
Great. Hi, everybody. Thank you for being there. I'll start by saying that I'm always excited to share these results, but at the same time, it's making me so nervous because I never know what to expect as a reaction from people. And as Erica said today, I know it's going to be a bit different for you than what you're used to, but I'm pretty sure you'll get out of this presentation and you'll feel like pretty happy about the results. So before starting, I just wanted to get back on something Erica said. Yes, I did go to Bishop's, and one main reason for conducting research about the English-speaking population was also that at Bishop's University, there was a really great scholarship program, and this allowed me to pursue my bachelor degree. During the 3 years, I was able to get a scholarship, which really helped me to focus on my study during the whole 3 years. So when I ended my degree, I was like, I need to give something back to the community, just like they gave something to me. So it was also, so conducting this research was really about giving something back, and also like a personal preoccupation with the language issues regarding access to health and social services. So this sets the place for the rest of the presentation. It's going to be a pretty standard presentation. So we'll first go over some key concepts so you understand really what is the research about. And then I will introduce the subject. I will present what is the objective of this presentation. Then I'll show you how I conducted my research, which is the methods. Then I'll present the main results, and we'll end with the conclusion and some take-home message. Health and social services are a wide range of services, which included, for example, the physician, doing physical activities, eating well, like nutrition services, affordable housing services, social participation, caregiver services, medication, cognitive health, Meals on Wheels, intergenerational activities. So what I want you to remember when listening to this research is that my concept of health and social services was similar to what you provided me as examples. So it's really a wide conception of health, and it's not just hospitals and physicians. It's really everything that improves the well-being of people. And what do I mean when I say access to health and social services? And this is the main part of the research. This is something that's really important to understand before I continue forward. So I wanted to explain it to you. Really, the access to the services is the possibility to identify a healthcare need, to seek healthcare services, to reach the healthcare resource, to obtain or to use healthcare services, and actually to be offered services that are appropriate to the need for care. So what I want you to remember from this definition is that it's not because you use a service that you have access to the service you need. And in your as an English speaker, for example, if your only language is English and you actually don't speak French at all, and they give you a service they give you a health and social service, but it's only in French, and you don't understand what they are saying to you, you do have used the services, but you don't have access to the service you need. So you don't really have a full access, and you can't really respond to your healthcare need. So the right to access health and social services is protected by law, but many English-speaking older adults report limited access to health and social services. And what the literature says is that older adults outside of Montreal may encounter different challenges when they try to access services because the services are less available in English. Why is documenting access to services important? It's because there is a high proportion of English-speaking older adults who anticipate using public services within the next 5 years, and about 40% of English speakers are bilingual. Thus, it leaves 60% of the English speaker who will require access to services in English. So my research and I really aim to learn about the barriers English-speaking older adults face when they access health and social services and the consequences of those barriers. And what are the strategies we can learn about the English-speaking older adults to overcome these barriers? This was done through a research project, so as said before, my master's thesis. To do so, I recruited English-speaking older adults that were aged 60 years old or more, and that considered themselves as unilingual. So for me, it did not matter if the person was able to speak a bit of French, but themselves I've had to say to me like, when I use health and social services, it needs to be in English. I don't consider myself proficient enough to receive the services in French. So it was really about their perspective. And also, to be part of the study, they had to have attempted to use the services within the last 3 years. So let's say someone told me like, I did try to use, for example, physical services, which provided me with physical activities, but I was not able to get them. They could still be part of the research because they had made an attempt to get them. So we wanted to know, is there any barriers that happen that completely forbids people to get the services? And during the research, we made sure to include people with different profiles. So the people that participated in the research had different age. They were living in different MRC. They had different health problems. They had different marital situation. For example, there was one lady, she used to live in Ontario all her life, and she's just recently moved to Quebec. So she was learning to navigate the whole health and social services system by herself, plus in a minority context now. So she had different point of view than other people. I also had one person that was married to a French-speaking person. So this person had access to someone to translate and to navigate the health system, which was easier for this person. So it gave us a different point of view. So we really wanted to make sure that we had many differing point of view when we collected our data. And what the research consisted of is that I met with the participant at the place of their choice. So most people I met them at home, and I started the meeting with this question. Tell me what you wish to discuss with me related to your access to health and social services today. And most of the time, before even asking this question, people were ready. They had a list of points that they wanted to address and discuss their experience. So it was a really, overall for me and for them also, it was a really positive experience because most of them told me like, it's really rare that I take this time to reflect on my experience and to think and to discuss it with someone else. Once I collected all the data, I talked with different community organizations to make sure that what I had was representative of the experience of English speakers, because I wanted to make sure that my data was valid. So I talked with them, and the community organization did confirm that what I had found was the same as what they heard between the lines in informal discussion or with their families and everything like that. So that really reassured me that I did the right thing. We'll now go over through the results. For some of you, the results might seem really obvious. And I get it. Like, this is often your reality. You will see things today that you might have already experienced, and you might think about it like, what was the point of this presentation? It's stuff that I know that happens to me. It's stuff that all the English-speaking community is aware of. Like, how is this novelty? How is this relevant? But what I want you to remember is that there's a difference between common knowledge and scientific knowledge. The common knowledge is something that is really widely known and accepted within a particular society or culture without necessarily requiring specific specialized education and training. The scientific knowledge is how you gather information in a systematic way. You test it, you verify it with scientific methods. So it's really based on empirical evidence. It's rigorous. There's some experimentation, and it's peer review, meaning that there's other researchers that will go over your data, your results. They will look at it. They will question you like, oh, why did you do this that way? Was there another way that you could do it? This way would be better, maybe. Or once they get, or they will look at your result and they will say, I'm not sure this is the right conclusion. Maybe you overinterpreted your result. Maybe what you found doesn't mean this. So scientific knowledge is really making sure that the results, the data you have collected is rigorous, it's valid, it represents the experience of people, and it's done the right way. So, and often what we need to remember is that scientific knowledge give rise to some consensus. So this is a knowledge that people share. And you might wonder, okay, then, it's fine, common knowledge is different than scientific knowledge, but why is scientific knowledge important then? It's important because it allows to preserve a trace of what is happening in a rigorous way. It also acknowledges what is known and what is unknown. And in the context of minorities, for example, language minorities, it shines a light on situations that the majority of speakers might not be even aware of. So for some of you, the results might be obvious, but for outsiders like French speakers who never really thought about this situation, the results might be something new that they were not aware of, that they will learn from. And also, by documenting what's happening, it can inform policies, practice, and it can act as a lever for change. For example, the results can be used for advocating, developing programs, etc. Just like Erika said, she found my research paper about these results because she had something to do with it. It supported her claim in different part of her job. So scientific knowledge is important, and that's what I want you to remember for the next part of the presentation when I will present the stuff, and you may think, oh, what am I learning from this? I'm not sure if it's that important, but yes, it is important. So just so you know, like I discussed earlier, some characteristic of the older adults I spoke with were that most of them were women. In fact, I've met with 7 women and 3 men. And most of them were also married, so 7 of them. There was 1 woman who was recently widowed, and 2 of them that were never married, and 5 of them had university degrees. They were aged between 72 and 90 years old. And like I said earlier, I was looking for people who had at least attempted to use health and social services. I was not able to find people that were not even able to use services. So most of all my research participants had used between 4 and 12 services in the past year. We will start now by discussing the barriers that we found that English speakers encounter when they access health and social services and the consequences of those barriers. So the first barrier we were able to find for English speakers was that the services were not only not elder friendly, but also not English elder friendly. And what we mean by that is that the way that the health system is organized, we could say, it makes it really difficult for English speakers to navigate the system. For example, like some of you said, there are the option press 9 for English, but people told me, oh, but when I press 9, nothing happens. Like my call just falls between 2 chairs and nobody is answering. Or if someone answers, they will speak in French. So what's the point of even pressing 9? Some people told me also like, oh yeah, there is English services, but the waiting list is so long that in the end, it doesn't matter. Even if I try to get English services, I'll never get the service. There's another person who presented me this situation. So I call that confusing communication. So she was at her home because she was gone. She received a phone call and she went to her voicemail. And she said to me, oh, there was a message in the machine. It was totally in French. It was very confusing. I got the gist of it. So she told herself, oh, I'll go see my neighbor. He is French speaking. Maybe he could translate me and explain me what the person wants. So she said, I had a neighbor to come in and listen to it because I wasn't sure what he wanted. So he listened to it 4 times and he said, I don't know what he wants, speaking about the person who left the message. And that was him. That was a French neighbor. So even a French person does not understand the message. How can you expect English speaker to navigate the system in those situations? This barrier gives as consequence is that most of the time English speakers are left with incomprehension. People told me that they had to rely on informal interpreters, just like this person told me like, oh, I went to see my neighbor, but she didn't like it because she was reliant on this person. So if this person is not available, she cannot do anything. Also, the fact that there's long waiting lists, it comes with delays. And when you're on the waiting list, you have a need that you need to address. Some people were telling me like, oh, now I don't even bother pressing 9 for English. I'll just use the French option. It's gonna be giving me the same result anyway. So what's the point of having a specific line if in the end it doesn't work? Another barrier that most people reported was that the knowledge and the exchange of information regarding English speaking services is insufficient. So the information is not shared within the community or by the health organization that offer English services. Like this person told me, I guess nobody has ever come to me with the service in my town. Nobody ever comes to me and says, well, did you know this or that about these services? That hasn't happened yet. So this person had really the perception that the information wasn't shared, and that is the main reason why he was not aware that there were some English services. For some people, this really creates apprehension. So they become a bit scared of the fact that they are not aware of the services that exist or they don't know about it. Some people anticipated that the health and social services would potentially be delivered in French. So in those situations, for example, this person is discussing a cleaning lady. So she told me, I know a couple who lives the street down there, and there's a girl that comes. I suppose that's a help, and she washes the windows and stuff like that. She can't speak any English. She could not come here because we don't speak French. So this person, just thinking about a hypothetical situation, this person sees a barrier and doesn't want to access the services because she thinks that because they won't be able to understand each other, they won't be able to use the service and have their need met. So this barrier is really important because what happens when the people who reported this barrier just didn't use the service in question. So we can say, okay, but this is a cleaning lady, this is not that bad. But the problem is, if the service you need is, for example, a physician, and you're scared you're not going to be able to get the service in English, you won't just use it. And in some situation, waiting to be treated for a disease or a health problem can have very important consequences. And in the context of the talk that I'm giving today, which is part of the Community Health and Social Service Network for Aging in Place, there was actually one lady who told me, like, I'm really frightened to speak of home care services. She was aware that she was going to this as she was aging, and she wanted to stay as long as possible in her home. But she was really scared that she would not be able to remain in place, because the CLSC do provide the services, but she would not be able to get it in English. So for her, this was really a barrier to aging in place, to living in her home, to staying where she feels well and supported by our community. Many English speakers in the research reported that the community tends to not complain much about unsatisfactory experience. And I'm not putting fingers on anybody. Most of them told me, yeah, but you're so used to not being taken seriously that at one point you just stop complaining and you accept the experience. Like, you just live with it and that's it. And people told me, like, well, some people don't make a complaint, but if you don't do it, it's not going to change anything. Like, there's no documentation, there's nothing to prove the point. So it's really important. But at the same time, I understand that when people complain, some of them were not taken seriously. So people just stop complaining. They just stopped complaining because they didn't see the point, and it was wasting resources and it was tiring. Another barrier that was found was the low percentage of English-speaking population. So for some speakers, the fact that they were living in a really, really French-speaking areas was seen as a major barrier to get the services they needed in English, because they felt that the services were really less available for them. In some instances, they felt that they had little social opportunities, so they had no opportunities to go outside, talk with people in English, and they had difficulties also mixing with the people in their communities because they could not communicate with the people around them. So, like this person says here, this is the first time in my life that I'm on a 100% French community. I mean, we're all senior citizens, that's for sure. I say, bonjour, comment ça va? But that's the extent. There is no social aspect of living here. And finally, many English speakers told me about the fact that for the English-speaking community, there's not enough caregivers left in Quebec, because most of the children have moved to, for example, Ontario, New Brunswick, so the English-speaking provinces. So it becomes really difficult to undergo home maintenance tasks such as shoveling, chopping woods, or getting support when consulting them when going to a consultation. In those situations, it's really the aging in place that's perceived as difficult. Another barrier that we found was that there were some financial barriers. So this person, the older adult, has limited means and combined with high service costs. So it's really hard to pay for the services because I don't have a lot of money. And at the same time, sometimes some services requires me to pay and the price is too high. Like this person says here, and now there is this new service, and now she was naming the town, which I took off for confidentiality issues, the senior home in this town, but the cost is outrageous. So the average person could not afford that. So the average person could not go there and get that services to be better. And finally, the last barrier is the lack of language concordance. So this is when the language spoken by the older adult doesn't fit with the one by the one of the health and social service staff. So the person here says that when this happens, she feels really dissatisfied. She told me, like, Well, I'm dissatisfied if I don't understand. I would really like it, appreciate having it in English. So I really know. I don't want to be guessing what they might be saying to me. So in addition to dissatisfaction, when the language is not concordant, people reported that they don't understand. Of course, it's not the same language. They felt excluded from conversation. In some situation, people gave invalid consent. So they agreed to get some care that they did not understand that they were going to get. And they feel like their needs are not met. So this part is a bit, I don't want to say depressing, but there's a lot of barrier. We hear a lot about negative experience within health and social services. And I didn't want to leave you this way with this negative perception. What was really interesting in the research was how the participants that I've met had strategies to overcome these barriers. So what are the strategies? So the first strategy that we were able to identify through all the data collected was that most people investigate for health and access related information in English. So this person, for example, told me, I learned about health and social services just by talking to neighbors or talking to people that I met through the church, mostly through neighbors, just to find out. So this barrier really happens because there is a lack of knowledge and exchange of information. So people discuss with them, discuss information, share the information. And this was done through several avenues. So this include word of mouth, newspaper, going to churches. There was a wide range of means that people were getting the information. There was one lady, for example, she told me that she read only the local English-speaking newspaper. There was another lady who told me that she read a French language newspaper because she knew that within that newspaper, there was a section that was written by an English writer, which highlighted the information related to health and social services for English speakers. And of course, like some of you discussed already, the community-based organization was a really important source of information. Another strategy that I found really creative was to create one's own services. So when the services available did not respond to the needs of the English-speaking seniors and the caregivers that were available, and many English speakers told me, oh, but we create our own services. So there were some people that were telling me like, oh yes, we created our own social groups. We meet each week to play bridge. There was another one who told me, I used to follow a physical activity group at my center, but then it closed. We decided, why not do it ourselves? Why not hire someone, split the bill between everybody in the group and follow this instruction, and we'll be able to get an English-speaking person. And there were other people that told me, oh yeah, but there was one girl at this, one lady at the church, she was sick. So we decided that each of us would take turns in taking care of her. So I was in charge of giving her the meals for this week. This person was in charge for this person. So there were really informal help that was being provided to this person. Another strategy was to enter the health and social services system offered in French or with the help from others. So like I said previously, when you press 9 for English and it doesn't work, or when the voicemail messages from health and social services provider are left in French, the people told me, okay, now I just don't bother. I don't press 9 for English, but I ask someone who does once there's someone on the line that answers. So if the person speaks in French, I will ask, oh, do you speak English? Some people told me, oh, I just ask my caregivers to make the phone calls and to tell me what happened, what was discussed. And the last strategy was really putting the responsibility of overcoming the language barrier either on the provider, splitting the responsibility on the provider and the English speaker, or taking the responsibility. And I will discuss all of them separately now. So what I say by putting the responsibility of overcoming the language barrier on the provider was that there are some people that told me, no, when I go to get my health, I always speak English and I only speak English. So if the provider talks to me in French, I will answer in English. That way they will see that it's really necessary for me to get access to services in English, and they will either switch in English or they will get someone who can speak English. And in some health and social services facilities, it is almost mandatory for them to get some help. The other one would say, for example, I will split the responsibility. So what this person told me is that, okay, what I do often is that I will start a dialogue that I call. So I will start to speak a bit in French, but I'll show them, oh, my French is not so good. And she said that often what happens is that this person, seeing that the French is not good and that the English speaker struggles, will switch to English, or will get someone who tries, or they will try to communicate in a way. And the last one was taking the responsibility. So the person told me, like, okay, I know I'm not a French speaker. I know sometimes they can't provide me with someone who speaks French. So I will come prepared to my appointment. I will bring someone with me who can translate. I will write everything down. I will find any solution to allow me to get the care I need. But they gave me certain warning about this strategy. For example, for sure, it's not always successful. It puts a lot of pressure on the English speaker because they have to make additional steps again. And sometimes you end up being excluded from the conversation when, for example, someone translates for us, not for us, but for you, and you're just there sitting on your chair and not being part of this conversation, and you might miss relevant information about your care because not everything is translated, and especially if the person translating is not as good as translating complex medical terms. So we're now getting to the conclusion. The take-home message I want you to remember for today is really that the experience accessing health and social services can be diverse. The participant really highlighted the importance of reporting inadequate or unsatisfactory situation, and that the results really showed, and this is a positive outcome of this research, because the results really highlighted the strength of the community and how resourceful were the older adults in this research. But at the same time, while the community is really close-knit and seniors are really resourceful, there is the risk that maybe we could over-rely on those characteristics, and it would lead to burnout from the people who keep helping others to access the services. I left some recommended resources here. For example, some information about the English speakers' right, also how you can use your local church, your local community organization, your meaningful social group based on your interest to gather information about the services in English. And I've also provided a link about research being conducted about the English-speaking community, which is available online, which this is like a big library which shows many different research papers and resources. And the link above is the research paper, which is in English, so about the strategies. So that's pretty much it for today. I hope you enjoyed the presentation. And as I said, remember that this was mostly to show you what I've collected and what we found, and that these results can be useful, for example, for policies or for advocating.
Yeah, so thank you so much, Alexandra. That was really, really interesting to hear the results of your research, both the barriers and the strategies being used. So I think the main question, and we kind of we tried to address this in the beginning, is like, with this knowledge that we have, what do we do next? Like, are there any tips or suggestions or ideas? Like, what are next steps? Now we have this knowledge, it's been published, that's excellent, but what are the next steps?
So what do we do with those? In fact, I'm really open to everything. Like, I went to the newspapers, I discussed the results in different organizations at different events with English speakers. But I think for now, it's really sharing the information that's important.
Yeah, Yeah, that makes a lot of sense. And it's a long-standing issue, and it's not something that's easily solvable
Mm-hmm.
in a presentation like this. That wasn't the intention, like you said before, you talked a little bit about scientific knowledge. It's about gathering information, right? And making it public so that people are sensitized and more aware of it, and that eventually decisions can hopefully be made.
And I think one of the main messages keep complaining, keep using the formal structures where they can document. Because if you don't have data, you can't do anything. But with data,
Mm-hmm.
like with the CAP organization, they can help you. And
Mm-hmm.
with more data, they have what's needed to support the claim to say, oh, okay, this is what's happening on the field. This is what people are experiencing. And I know, like, it must be tiring because you're already in pain. You already have some issues. You're not using health and services most of the time because you're feeling well. People tend to use it when there's a crisis, and you don't want to bother because there's so much more things to do for your health. But if there's nothing documented, you can do anything.
We're also conducting a needs assessment related to access to health and social services for English speakers as well. So that information, and the information from Alexandra's research and anything else that's gathered is going to be used to raise awareness and sensitize French-speaking healthcare people at all levels, so that hopefully slowly things can change. On behalf of everyone, a huge thank you to Alexandra for being here all the way from Sweden. And I think it was really empowering also to learn about the resilience of English speaking older adults and the strategies that they use to navigate complex health systems despite the language barriers. So, really interesting work that you did. And thank you for taking the time to share it. If you want a list of the research, reach out to your local community organization. They have an outline that they received with all of the links. Thanks so much. Take care, everyone.